The MONALEESA-2 study evaluated the role of ribociclib in addition to letrozole versus letrozole and placebo for the first-line treatment of hormone receptor-positive advanced breast cancer patients. The aim of this update that was presented at the ASCO 27 meeting was an updated progression-free survival, and I also shared the quality of life data from this study. So we'll talk about the updated progression-free survival data first. As many of you know, this data was initially presented at the ESMO 2016 meeting. It was published in the New England Journal of Medicine, and now the updated progression-free survival shows that the control arm with letrozole plus placebo, the progression-free survival is around 16 months, and in the ribociclib plus letrozole arm, the progression-free survival is 25 months. The hazard ratio of around 0.56, which is consistent with the hazard ratio that was seen previously. What was not seen previously was a median progression-free survival that was reached. Now we have a progression-free survival of around 25 months, so we have a milestone to say what do we and how do we compare it to the control arm. Furthermore, in addition to this data from the progression-free survival, I also shared the data on the quality of life. So quality of life was a secondary endpoint of the study, and we looked at quality of life for patients in both arms. And overall, there was no difference in the quality of life between the two arms, probably highlighted that these were first-line metastatic breast cancer patients, and their quality of life was reasonably good to begin with. We did not see any difference due to adverse events affecting the quality of life for patients in the experimental arm, so the quality of life was maintained through the course of the therapy. What we did see, which was interesting, was that there was an improvement in pain scores in patients on the ribociclib and letrozole arm compared to baseline, above the clinical meaningful differences that were allotted. So there was improvement in pain scores compared to baselines, indicating that there is a response to symptoms. So the key conclusions was quality of life was maintained, the side effect profile associated with ribociclib did not adversely impact quality of life, and the patients did notice a clinically meaningful improvement in pain scores compared to baseline.